everybody. Today I am going to present the major findings on the first longitudinal aging study in India. Already sir mentioned that why it is important, because if you think about next 30 years or 40 years or so with regard to research in public health, aging is a very important area to research, because many of us already know about the disease burden and non-communicable diseases. And if you look at the statistics globally, the non-communicable diseases mostly, related to the aging. So this presentation, I hope, would throw some lights on the statistics which we collected during the survey, during the study. So introduction, population aging, which entails an increasing share of elderly ages 60 and above in the population, represent an unprecedented global transformation and expected to intensify during the century. The global life why aging has happened? Because the life expectancy has increased tremendously over the period, over the last we should say 70-75 years or so. If you look at the life expectancy of 1950 and life expectancy of 2015, that is 60-65 years, for males it has increased around 29 years, whereas for females it has increased for around more than 30 years. And we expect that it will be even more by 2050 as projected by United Nations. Now, if you look at the statistics related to elderly population in our country, we could say, as per census, last census, that is 2011, we have around 8% of our population, or 9% of our population was more than 60 years of age, which is projected to be around 20% or 1/5 of our total population by 2050. And more importantly, the oldest old, that means 75 years and above, will increase by 3.4 times between 2011 and 2050. Yes. So why I was keen to present these results? Because it is a full-scale national study giving the results at state level, covering all the states and union territories of the country, try to give a picture on health, social issues related to aging, and economic issues related to aging, and the consequences of population aging in the country. It covered around 72,000 individuals aged 45 and above in the country, including 31,000 or more than 31,000 people aged 60 and above, and also including 75 and above. Why it is important? Because it is the first in nature. In India, we have carried out the survey for the aging population, or broadly said, the people aged 45 and above, and world's largest, because we have the huge population base. So it is the world's largest according to the aging survey. It will be helpful to prepare the database for designing policies and programs for the older population, as we mentioned earlier, with broad domains of social, health, and economic well-being. it can be compared with health and retirement study or its sister studies around the world to enable cross-national comparisons. Major findings. So looking at the major findings, what I did not give in the presentation, but broadly what we found that around 27% of the people are in the age group are marked as children, or in the age group we could say 0 to 14 years of age. 12% we found more than 60 years of age, and the remaining 61% are in the working age group or 15 to 59 years of age. The percentage of elderly, as expected, we could found more in the demographically developed or advanced states like Kerala. We found 20% aged population, Himachal Pradesh 17%, Tamil Nadu 16%, Puducherry 16%, and Goa 15%. On the contrary, we found lowest aging population in Arunachal Pradesh, only 6%. The overall sex ratio, what we found, was 984 females for 1,000 males in the country. But for the aging population, it is 1,065. As we all know that females are living longer because they are biologically stronger than the males. So we found that in our study. So if you look at the household amenities and exposure to indoor pollution, 14% households were found exposed for indoor pollution. More than half of the household, 52% household, used clean cooking fuel. Around 2/3 of the household reported they have drinking water facility either inside their dwelling or in the yard. Nearly 3/4 of the household reported they are using improved sanitation facility, and a majority, more than 90% of the households found having electricity and improved source of drinking water. Hitenji, I cannot find the slide.
So we are on the file of type of sanitation facilities. Are you able to see the slide?
Now, if you look at the type of sanitation facilities, even during 2015, 16 or 17, when we did the survey, more than 1/3 households in the rural India used open spaces for defecation, whereas nearly 3/4 households in urban India reported having flush or pour flush toilets for sanitation. Next. Now, looking at the catastrophic health expenditure at various thresholds with regard to monthly per capita expenditure. Catastrophic health spending occurs by definition when it amounts to 10% or more of the total consumption expenditure at the household level. So if you look at the figures, more than 1/3 households, around 34% of the households, had reported that they use 10% or more of the total consumption expenditure as health expenditure. The extent of catastrophic health spending declines with the increasing monthly per capita expenditure. Even 18% households incurred catastrophic health expenditure at the 20% cutoff level. What we found, besides this, catastrophic health expenditure is the highest in Jammu and Kashmir, 51%. So more than half of the households, followed by West Bengal, 44%. Sorry. The same we found lowest in Andaman and Nicobar, 7%, followed by Daman and Diu, 14%. In both outpatient and inpatient care, what we found, medicine accounts for the largest share of health expenditure. Now, if we look at the monthly per capita expenditure and income of the households, we found that household does not have any elderly, that means 60 and above person. The monthly per capita expenditure was more than rupees 4,000, whereas monthly per capita income was more than rupees 4,000, whereas the monthly per capita expenditure was around rupees 3,000. But if a household is having at least one elderly person, the monthly per capita income has come down to around rupees 3,500, but at the same time, the expenditure was again around rupees 3,000. We tried to distribute the households with only one source of income. Majority of the households, 70%, mentioned that the source of income was wages and salary, followed by agriculture and allied activities by around 1/5 of the households, 20%. 5% mentioned that pension is the source of income. Now, coming to the loan, the proportion of households who had taken loan, any loan, is around 32%. That means nearly 1/3 of the household of the country has taken at least one type of loan. Now, if you look at the various types of loans, we could find that in urban areas, nearly 1/4, 27% household mentioned that they had taken loan for construction of house or improvement of house. And almost similar figure for healthcare expenses, 26% in urban India. Whereas in rural India, it is 19% each for construction of home and purchase of agricultural assets, and 17% each for marriage expenses and other type of loans. It should be noted here that 15% of the rural households mentioned they had taken loans to meet the expenses related to healthcare. If we look at the median amount of loan, the median amount of loan has come as around rupees 2,13,000 rupees, whereas in rural areas it is 1,42,000 rupees, and urban areas it is around 4,71,000 rupees. Coming to the household health insurance, we all know that IIHMR Bharat has started recently, but it is worth mentioning that when we did the survey that time, IIHMR Bharat was not launched, was not started. The findings suggests nearly 1/4 of the household, that is 26% of the households reported having any sort of health insurance. Around 21% was covered by Rashtriya Swasthya Bima Yojana at that time and allied schemes. Nearly 2% mentioned they are covered by either central government health scheme or ESI, whereas 1% each mentioned about privately purchased commercial health insurance or medical reimbursement or insurance by the employer. From household characteristics, coming to the individual characteristics. So if you broadly divide our findings, so we had, out of the total respondents, 54% of the respondents were from 45 to 59 years age group, and the remaining 46% from 60 and above, that is elderly population. 58% were females and 68% from the rural population of the country. But when we looked at the educational attainment of the respondents, we found that 63% of the females did not attend any sort of school, whereas 37% of the males amongst our respondents did not attend our school. We all know that the literacy rate is around 74% according to the last census, but point to be noted here, our respondents were 45 years and above. That's why the literacy rate was, only 37% for the females and 63% for the males. Looking at the marital status of the respondents, we found that more than 90% of the males in the age group 45 to 59 reported currently married, whereas 84% females reported currently married. And for 60 and above, it has come down to 81% and 44% respectively for males and females. So widowed, that is a complementary to the currently married population. So 16% of the males reported themselves widowed in the age group 60 and above, whereas more than half of the females in the age group 60 and above were widowed. Working status. A majority of the males in the age group 45 to 59 found working or currently working, 92%, whereas 6% males reported working in past but not currently. For the females, only 22% reported that they are currently working. So that means less than 1/4. Whereas 1/3 of the females reported that they were working in the past but not currently. And that again, justify in line with the government statistics, because in the last 5-6 years or 10 years we found it from the government statistics, the number of females in workforce participation in the country unfortunately has gone down in last 7-8 years, and our statistics is also suggests the same. And again, the never worked female is around 47% for 60 and above, and 44% for 45 to 59 years of age. Now, what are the type of main job? Now, what is main job? There are two types of jobs according to the definition of Census of India. One is main job, another is marginal work. So main job is defined as, according to Census of India, if a person is involved in any sort of job for at least 182 days in a year, that job is defined as main job for that particular person. Now, if we look at the main job for males, again, it is farm or fishery or forestry held by own or family, 46% of the males. So main job by and large is reported as, farm activities or agricultural activities, and the same 37% of the females reported main job as farm or fishery activities. Besides that, 33% females also reported that their main job is agricultural labor, or they are working as agricultural labor. In urban area, the main job, as expected, is wage or salary, followed by own account worker, that means own business, and then non-agricultural business in urban areas. But in rural areas, amongst the males as well as females, it is agriculture, farm, fishery, or forestry. In almost all the states and union territories of the country, a larger proportion of elderly workers are engaged in agriculture and allied activities than of their older adult counterparts. That means 60 and more are more involved in agriculture and allied activities. For example, in Nagaland, 90% elderly, Himachal Pradesh, 81% elderly, Chhattisgarh, 77%, Jharkhand, 76%. Whereas in Delhi, it is 59%, Jammu and Kashmir, 41%, and Goa, 38% elderly reported as self-employed. Nearly 2/3 elderly in Chandigarh, 66%, are engaged as salaried workers. Now, if we look at mean monthly earnings, the mean monthly earning suggests that from agriculture, it is around 5,000 rupees for 45 to 59, and also for 60 and above, slightly less than 5,000 rupees for 60 and above. If it is self-employed, it is 9,500 rupees for 45 to 59, whereas around 8,000 rupees for 60 and above. For wage and salary, it is more than 12,000 rupees for 45 to 59 years age group, whereas it is around 7,000 rupees for 60 and above age group. If you look at the statistics on retirement and pension, because this is a very important statistics, because we all know that we are going to be gray in coming 30-40 years, but at the same time we know that we do not have enough social security in our country. So the survey, the study tried to capture the data, how many persons are receiving pensions. So officially retired, if you look at the overall statistics, around 7% of the respondents mentioned that they have officially retired from their jobs, whereas only around 6% mentioned they are getting pension currently. As expected, it is slightly higher in urban areas of the country than the rural areas. Now from economics, we are coming to the health. Now health, we would like to discuss about broadly in two parts. One is the health conditions already diagnosed and reported during the interview. And second, not diagnosed, but we did various tests in the field, including test for hypertension, blood glucose, near and distance vision, balancing test, spirometry test for lung function, so on and so forth. First, we would like to discuss about already diagnosed. That means when we went for the interview, at that day, the person knew that he or she is suffering from one particular disease or more than one disease, already diagnosed. Cardiovascular diseases, more than 1/3 of the elderly, that means 60 and above, have reported that during the time of interview, they had already having cardiovascular diseases, more than 1/3. Hypertension, another 1/3 mentioned that they had hypertension. Nearly 19% of the respondents mentioned about any bone or joint disease, including arthritis and all. 14% reported having diabetes mellitus. Nearly 8% mentioned any chronic lung disease. 5% regarding heart disease. 5%, another 5% mentioned about anemia. 3% mentioned about stroke. Nearly 3% talked about psychiatric or neurological problem. Another 3% almost mentioned about cholesterol. Less than 1% mentioned they had diagnosed with cancer amongst our selected respondents. Now, if you look at the chronic health condition, according to age, as expected, it is mostly concentrated, I must say, 65 onwards amongst the study population. But at the same time, if we look at the age distribution of various chronic health diseases, more specifically hypertension and cardiovascular disease, because 1/3 of the elderly already mentioned they had hypertension and or cardiovascular disease. So now look at both the figures for hypertension and cardiovascular disease. 17%, almost 1/5 in the age group 45 to 49, and 19% mentioned about these two, hypertension and cardiovascular disease. Increased to around 23% and 24% for the age group 50 to 54. Again increased around 25% for hypertension and 28% almost for CVD for the age group 55 to 59, and continuously increasing. Around more than 1/3 have reported having cardiovascular diseases for the last 3 age groups, 65 and above, more than 1/3. And again, almost 1/3 or more than 1/3 have reported for hypertension for the last 3 age groups. Diagnosed organ-related disease for the elderly, again 60 and above. Highest we found for any sort of eye problem, more than half of the elderly mentioned about any sort of eye problem while talking about organ-related disease, followed by cataract, gastrointestinal problem, complete edentulism, any hearing or ear-related problem around 10%, and any urogenital condition around 8%. Now, if you look at the morbidity conditions according to age, we found there is almost continuous increase in percentage of single morbidity and multi-morbidity as age increases, except a few exceptions. So from 10% multi-morbidity increased to around 25% from 45 to 49 years of age group to 70 and 75 and above age group. Similarly, single morbidity has increased from 22% to almost 32% over the age groups from 45 to 75 and above. Another important aspect for the aged population is fall or injury related to fall. We tried to capture data pertaining to fall or injury related to fall in longitudinal aging study in India. Like morbidity, we also found as age increases, fall or injury related to fall has also increased from again 13% to around 21% injury related to fall from age group 45 to 49 to 75 and above. Now, if we look at the prevalence of high blood pressure, now from this one, we are going to give you what we measured in the field. Already diagnosed around 1/3, And we have, as I mentioned earlier, we have done some testing in the field, like we measured the blood pressure, we did blood sugar check, and so on and so forth. From there, we could find that 37% of the elderly were suffering from hypertension, and more importantly, out of them, 22% was undiagnosed. That means we diagnosed that in the field. In rural area, it was 19.5%, slightly higher than urban areas, 19.4%. But again, there is a difference between males and females. Undiagnosed hypertension for around 22% males, whereas it is amongst 18% of the females. Coming to the lung disease, in the survey, in the study, they have divided the lung disease into two parts broadly. One is restrictive lung disease, another is obstructive lung disease. So if we look at the figures for restrictive lung disease, we could find more lung disease, restrictive lung disease as expected in urban India, 46%, almost similar number for various age groups, 45 to 59 or 60 and above, almost 40%. And the total is around 40%. So that means 40% of our population found having restrictive lung disease, age 45 and above. Coming to the obstructive lung disease, as I mentioned, we have done spirometry tests in the field. Around 6% of the elderly found having obstructive lung disease. It is more amongst males, 7%. And for moderate obstructive lung disease. Whereas around 5% of the people found having moderate lung disease and 4% found having mild lung disease. That means here, if we add moderate and mild, we could find around 9% of the population was having obstructive lung disease, whereas around 40% of the population found having restrictive lung disease. Overall, half of the population, 49% of India's population had any lung disease, including restrictive or obstructive. Now coming to the visual impairment. Overall, in India, 37% of older adults age 45 and above have either low, near or low distance vision. So more than 1/3, 37%. Almost half of the elderly age 60 and above, 47%, have low vision compared to 28% in the age group 45 to 59. Low near vision, we found amongst around 1/4 of the respondents in the age group 45 to 59 more amongst females, and nearly 32% low near vision amongst 60 and above. Again, it is more we found in rural India while comparing with urban India. Coming to the very important component, nutritional status. We all know Government of India is running Poshan Abhiyan, but that for children, Anganwadi center, for mothers, Anganwadi center, for adolescents, Anganwadi center, for the females in the reproductive age group, from Anganwadi center. What is the situation of nutritional status of our elderly? Look at the last bar. More than half of the elderly females, 51%, are underweight. Again, I am repeating, more than half of the females, 45 and above, are underweight. It is more in 60 and above, slightly more, 27%. But look at the situation of the females even at the older ages. That means it is not only amongst children, adolescents, or reproductive age group females. I am happy to share that the Government of India, only on 7th of this month, the Government of India is announced to start the Poshan Abhiyan for elderly in our country. More specifically for malnourished elderly who are not in any old age home and mostly destitute will be identified for the scheme. They will be provided hot cooked meal daily. To begin with, the meal will be offered in 2,000 panchayats and 200 municipalities covering 55,000 elderly daily from designated Anganwadi centers. It will be scaled up to reach 2,75,000 elderly in 10,000 panchayats and 1,000 municipalities by 2024-25. This is a recent scheme of the Government of India, only announced on 7th of this month. On the contrary, we mentioned about underweight females, more than half of the females. On the contrary, high risk waist circumference and waist hip ratio. Now look at these statistics. Waist circumference, high risk. We found more in urban areas as expected, 43%. More amongst female, 39%. And more in the age group, 45 to 59. And looking at the waist hip ratio, again, more in urban areas, slightly more amongst females, and it is more for age 60 and above, slightly more, almost similar values for 45 to 59 and 60. That means it is another angle to look at the health of the females, health of the elderly and females, obesity, we all know that that may lead into, degenerative diseases. We tried to collect information on grip strength. So we found that mean grip strength, as expected, was more amongst younger persons, 45 to 59 years age, and we found it slightly more amongst the respondents from urban India. Now, if you look at the age pattern of various, health indicators, low vision was highest as expected in 75 and above. High blood pressure we find highest again in 75 and above. Underweight, at the same time, we find more among 75 and above. For obesity, we found highest in the youngest age group of our study, that is 45 to 49 years of age. Mean grip strength, we found, has an inverse relationship with age. That means as age increases, mean grip strength of the dominant hand as well as non-dominant hand has reduced for both the sexes, for males as well as for females. The consistent pattern. Coming to the mental health part, it's a very important aspect. We collected information in LASI regarding cognition. In LASI, participants' cognitive abilities were assessed on 5 cognitive domains. The range for each domain score of cognition, like for memory, it was from 0 to 20. For orientation, it was from 0 to 8. For arithmetic function, it was from 0 to 9. For executive function, it was from 0 to 4. And object naming 0 to 2. A summary composite cognitive score was generated by combining the scores from all 5 cognitive domains, ranging from 0 to 43. With higher scores indicating better cognitive ability. The mean score for each cognitive domain, like memory, orientation, arithmetic, and executive function, and fluid intelligence, decreases with advancing age. The major finding. So composite cognition score suggests a slightly higher cognitive scores, as I mentioned, in the younger age group for males and females both, while comparing with elderly, that means 60 and above. In urban India, we found higher cognitive score. But while analyzing or while interpreting, I must mention one thing, that cognitive ability score of the elderly age and 60 above, we found closely related to educational attainment across all ages. Age-associated decline in cognitive abilities score is consistent across states and socioeconomic spectrum. Mean composite cognition scores decreases with lower levels of education and with advancing age. And this decrease is more pronounced in elderly age 75 and above. Mean composite cognition score declines from around 31 or 30.9 for those with 10 or more years of schooling to 19.5 for those with no education. Depression. Now, like cognition and depression, two internationally validated and comparable tools are used to assess depressive symptoms and episodes. First, the Center for Epidemiologic Studies Depression, CESD, scale was used to identify the presence of depressive symptoms. That means CESD was only used to identify the presence of depression. Then Composite International Diagnostic Interview, CDSF scale, a structured interview scale was used for diagnosing probable major depression. The overall proportion of older adults in India aged 45 and older who screened positive for depressive symptoms based on the first scale, that is CESD, is 28%. That means more than 1/4 of the respondents were screened for the set of questions, structured question we used in CDSF. That's a huge number. 30% of the elderly, that means 60 and above, and 26% in the age group 45 to 59 were screened for using the tools related to CDSF. So they had presence of depressive symptoms, 28%, 30% for 60 and more, and 26% for younger population, younger adult, 45 and 59. Overall, we found depression according to the age group more than 9%, 75 and above, 8% 60 to 64, and 7% 45 to 49. Figures are in front of you. The prevalence of probable major depression among older adults aged 45 and above in India is around 8%. The prevalence of probable major depression among the elderly aged 60 and above, 8.3%. That is basically 10 times higher than the self-reported prevalence of diagnosed depression, only 0.8%. to 8.3%, suggesting a markedly higher burden of undiagnosed depression in the country. The comparison of CESD and CDSF outcomes suggests that in India, close to a third of elderly age 60 and above, we mentioned 28%, have had depressive symptoms, whereas 1 in every 12 elderly 60 and above, 9%, 1 in every 12, have a major depression. Now, physical and mental impairment. So, when we talked about various types of impairment, we can broadly divide impairment into 5 categories according to, again, census: locomotor, mental, visual, hearing, and speech. Now, for all the age group, for all the impairment, all sorts of impairment, we found higher percentage as expected for more than 60 amongst elderly or more than 60 years of age. Locomotor reported by 6%, visual impairment 4%, hearing impairment and mental impairment by around 3%. Elderly. Overall, about 11% of the elderly age 60 and above reported having at least one form of impairment out of these 5, 11%, 60 and above. Whereas 6% in the age group 45 to 59 mentioned having at least one sort of impairment. Impairment rates we found especially higher among the elderly in rural areas, elderly with less than primary education, and elderly living alone or divorced, deserted or separated. Coming to the activities and instrumental activities in daily living. Elderly many a times face problems while doing their daily activities or daily instrumental activities. Now, daily activities refer to the normal daily self-care activities such as movement in bed, changing position from sitting to standing, feeding, bathing, dressing, grooming, personal hygiene, etc. Whereas instrumental activities of daily living allow an individual to live independently in a community. They determine the level of independence and the need for supervision or assistance for the elderly on a day-to-day basis. Now, IADL may be counting of money, making phone calls, going to new places, so on and so forth. So we tried to explore whether elderly found having problem doing daily activity or daily instrumental activities. At least one instrumental activities limitations problem doing at least one instrumental activities. 48%, almost half of the elderly mentioned that they were having problems doing at least, out of all the instrumental activities, at least one instrumental activities. Two, again 37%, two or more than two. Similarly, for daily activities, normal activities for normal life, around 1/4 of the elderly mentioned they found having problem in their daily normal activities. Now look at the various activities of daily life and instrumental activities of daily life and the problem mentioned by the elderly to do so. 7% mentioned they found problem during dressing. Another 7% mentioned for bathing and walking across room. 8% mentioned eating. 12% mentioned getting out of bed. And around 18% mentioned about using toilets. So these 6 activities related to daily life or normal lives. Coming to the instrumental activities. Taking medication, 16% mentioned they found problem to take medicines on their own. 18% found it problem to cook hot meal. 1/4 found it problem to do shopping. 27% found problem in gardening. More than 27% or 28% found difficulties while managing money. 29% found it difficult to make telephone calls, whereas 30% reported that they found it difficult to get around in unfamiliar places. That means they would require some sort of help or assistance while doing these activities. Use of supportive aid and devices. For physical disability, more than 60, 10%. For denture, it is 3%, around 3% in all the categories. Hearing aid, use of hearing aid is less in our country till now, because we all know that the cost of hearing aid. That may be one of the reasons of less using of hearing aid.
Dr. Arindam, how much time will you take?
Sir, I will take 5 minutes more.
Okay, that's fine. Thank you.
I think it is 11. Okay, sir. Now coming to the various habits related to health, tobacco consumption. So smoking, currently smoking 13%, 60 and up, 14%, 60 and above, and only smokeless tobacco 21%, so more than 1/5. While currently using smokeless tobacco 60 and above, again 21%, and only smoking is 16%. Alcohol consumption, infrequent alcohol consumption by 9%, elderly, frequent non-heavy drinker around 3% elderly, and binge drinking another 3% elderly. Physically active elderly. As expected, females reported or found having physically more active than the males amongst the elderly, as well as 45 to 59 years of age than their male counterparts. Hospitalization in last 12 months. So as expected, as age increases, hospitalization increases. So around 8% hospitalization in last 12 months, that means inpatient care for elderly. And it has increased to around 9%, while we have taken only 70 and above. Overall 7% hospitalization from age 45 and above. Hospitalization according to monthly per capita expenditure. Again, there is a positive relationship. So hospitalization, we found more amongst the richest group of the respondents and least amongst the poorest group of respondents, irrespective of the age category. 13% for 60 and above for the richest group, whereas 5%, so almost 3 times poorest to richest. Health facility. Now we all know about health system. We talked about many a times about the poor conditions of public health facility. What data suggests pertaining to hospitalization of our study population, except the poorest group, for all other groups, look at the figures. For all other groups except the poorest group, the utilization of public health facilities is less than 50% and continuously reduced as we are going from poorest to poorer, poorer to middle, middle to richer, and richer to richest. Inverse relationship between wealth quintile and utilization of public health facility for hospitalization. Look at here, 40 utilization of private facility, 44% to 50% to 55% to 67% and 71%. Continuously increase in utilization of private health facility and non-utilization of public health facility. Median, whereas the median out-pocket expenditure during hospitalization for public health facility less than 10,000 rupees to more than 71,000 rupees for the age group 45 to 59, and total it is 8,877 rupees for public facility, whereas for private facility it is more than 50,000 rupees. Even then, people were interested to use private health facilities. Living arrangements, living with spouse and children, mostly 41% of the elderly living with spouse and children. On the contrary, 6% living alone and living with others. They shared their personal matters who do not have spouse, mostly with children or grandchildren, 70%, followed by son-in-law, daughter-in-law, around 20%. Elderly receiving or providing financial support, 17% in the rural areas, elderly mentioned they received any sort of financial support, whereas 6% mentioned they provide financial support. Question was asked to understand whether the elderly were experienced any ill treatment or abuse. 37% mentioned they were abused either by their children or grandchildren. 36% mentioned about son-in-law and daughter-in-law, and another 1/3, 34% mentioned about others. Elderly aware about various social security schemes. More than half of them aware about old age pension scheme, 45% in rural areas, and around then Annapurna scheme and widow pension scheme. Around 45% in rural areas knows about widow pension scheme. But while coming to utilization, the figure has come down drastically. Old age pension received by 30% in rural areas and 22% in urban areas. Widow pension received by 25% in rural areas and 18% in urban areas. Annapurna scheme even around 2%. Thank you.